Up next on A Seat at the Table, Black women are more likely than any other race to die from labor and delivery complications. Why is that? Stay tuned.
Hello and welcome to A Seat at the Table. I'm Christine White and today we're discussing maternal mortality.
I'm Deneen Milner. Labor complications and death during childbirth is not a thing of the past.
And I'm Monica Pearson. The situation is only getting worse.
So I like what I see when I'm looking at me when I'm walking past the mirror. Don't stress through the night at a time and my life ain't worried about if you feel it. Got my head on straight, I got my vibe right. I ain't gonna let you kill it. See, I won't change my life just fine.
Okay, so we're talking about the problems we as Black women have when we're talking with our doctors. And so many of us lose our fertility very early on. In my case, it was with endometriosis. And every doctor I went to at first said, oh, when I kept saying I'm having these horrible cramps, I don't know why I'm having this bleeding, I don't know what's wrong. It's in your head, you know, maybe you're just having an abnormal period. And by the time someone took it seriously, the endometriosis had really gone further than it should have. I had to have surgery to remove and fix. But by the time they did all of that, the third doctor I went to see said, you're gonna have to have a hysterectomy.
Wow.
So I'm, 40 years old and going, what?
Yeah.
And I found that I had to become an advocate for my own health because it seemed in their case that, you're supposed to be able to spit out babies anyway, and if you're having this problem, what did you do that caused this?
Right.
It was horrible.
Right.
Well, the racial bias that we experience in everyday life, we also experience in the medical field. So the same egregious results that happen when an unarmed Black child is shot down in the street, those same egregious results happen when there's bias in the medical field with doctors and physicians. And just not taking Black lives seriously, we don't have the opportunity to get the same type of care and the same type of treatment. When I gave birth to my daughter, my doctor was a doctor that I'd known literally from childhood. He delivered my cousins. He was my grandmother's OBGYN.
Wow.
He was a part of the family. And I was treated as if I was being treated by, a member of family. I felt as safe as if it was my father himself or my uncle who was helping me through the delivery process. And so I never really had an experience, but I've heard of these experiences. And I know, Deneen, you have an incredible story.
Listen, I did everything that I was supposed to do the right way. I put together a birth plan. I picked the hospital that I wanted to be in. My OBGYN was on point. I loved her, met all of the folks who practice in her practice so that I could make sure that if she couldn't be there, I knew the doctors that would be there in her stead. I even paid extra money to have a private room and make sure that that moment when I was going to bring a life into this world, my baby was special. And it was when my doctor came in and she caught my baby and, I fell instantly, hopelessly in love. But the moment that they took my baby away from me, the craziness began. They tested her for drugs without my permission or, knowledge. I got her back and I was like, why is there a prick in her foot? Like, what did you do? Why is there a prick in my baby's foot? Oh, we tested her for drugs. Why are you testing my kid for drugs? I don't take drugs. I've never taken drugs in my life. Well, we just do it just in case to make sure that if you're on drugs, your baby won't have drugs and we can treat your baby. Well, what about me made you think that I was taking drugs? So then I get the baby back and they put me into this room with 40 other women. It felt like we were in a cattle prod.
You had paid for a private room.
I had paid for a private room. When I told them I paid for the private room, that's when it really got ugly. This is, who do you think you are, paying for a private room? That's your husband? You're married?
Oh wow.
Really? He can't be in here. Well, that's my husband. That's your husband? So by the time we made it into the private room, because now they're making me wait for 3 hours before they put me in the private room because I think I'm better than somebody. Then they finally put me into the private room. And I tell them that I'm breastfeeding my baby. So they get upset because who told you to breastfeed your baby? Here's some formula to give your baby.
no.
Child.
So they disappear for 11 hours because I told them that I was going to breastfeed. They disappeared for 11 hours.
And so you're building up milk.
Right. And still didn't know how to feed this child the proper way, didn't have any diapers to change her. It was just a nightmare. And I talked, my OBGYN was on vacation. She actually left vacation to come and catch my baby. And then she left, and one of her partners came. And I told her, you know, the laundry list of craziness that was happening, and she let me go. That was the tame one.
Yeah.
When Lila was born, I was in a hospital in New Jersey, and I felt like I was being treated like I was a medical condition to be managed instead of doing what was the most natural thing that I could possibly do, which was to have a baby. I'm hooked up to all these machines. They won't let me move. They literally made me lay on my left side for 17 hours talking about, oh, the baby's heartbeat was off, and so I had to lay on my left side. And who am I to argue? Like,
Right.
if you say my baby's in danger and I need to lay on this side, then I will. But at what point do we decide that 17 hours is enough? Can I please turn over? And the moment I turned over, dilated, ready to go. My doctor's downstairs eating lunch. She doesn't want to be bothered with coming upstairs to catch my baby. So I am literally there, legs splayed, head crowning, and some random man peeks his head around the corner, sees the baby, and says, "Woo, your baby has a lot of hair." Really?
What?
Can somebody call the doctor so that I can push this baby out? And so he came over and gave. I have no idea who this man was.
Yeah, I mean, there will
idea.
there will be some people who say that your situation was an isolated incident, and they'll
It's
say
not.
that
It's not.
it wasn't race motivated. My sister is a physician. It was not until I began to hear the stories of her working in the hospital and how women are treated, and Black women time and time and again are misbelieved when they have the same.
But Serena.
Yes.
Serena, let's talk about Serena Williams.
Right.
She's wealthy. She has a
Yes.
white husband. Okay? She's having a baby. She knows her condition,
Right.
embolisms, and they don't believe
Right.
her.
Don't listen to her.
She has to act a fool
Right.
in order to get the care that saved her life.
And because she's an athlete, she knows her body. She
Yeah.
knows
Right.
what medication she's on. She knows when she has a blood clot.
That's right.
And she's asking them for a CT scan, and they think she's confused.
Right.
I mean, and she's trying to breathe because the clots are in her lungs.
Right.
And so trying to get out this information and advocate for yourself while being a patient is just infuriating. She says she almost died.
Right.
And it's
Right.
so sad that this is happening all over the country, because after that story broke, I mean, we've been talking about maternal mortality for a really long time, but it took that story to break for so many people to say, I had a similar experience.
Right.
And that's what I want people to understand, is that, you know, these incidences aren't isolated, and we have to take it seriously. And it's based in the historic institutional racism that sort of this country has been built around.
I'll tell you, one of the most brilliant things I read on the subject was a story in the New York Times by Linda Villarosa. She is an incredible health writer who has been writing about health in the Black community for years and years. And she wrote a piece in the Times that I encourage the viewers to Google, Linda Villarosa, New York Times, Black maternal health, and read that story from beginning to end. She opened it with the story of a mother who had a baby and died.
Right.
And it was her job to study this at the CDC. She worked at the CDC. She studied this very thing and ended up dying because no one took her seriously. The very thing that she was studying and trying to figure out what was the cause of, she died from it.
But no one, in many instances, when you're a Black woman, they think you can take more pain.
Right.
They think, do you know what you're talking
Right.
about? We are questioned
Right.
far more
Right.
than a white woman would be.
Right, absolutely.
This is deep. We got to take a break, but we'll be back with a husband who lost his wife shortly after she gave birth to their second son. and a healthcare advocate on a mission to improve Black women's health.
People of color, their pain is not treated as effectively as their white counterparts. Take, for example, a patient walks into the emergency room. We know that patients of color get their complaints coded as less urgent than white patients. What happens is they get longer wait times, and then they also have less time with their physicians.
And what's the reaction when you talk about this in the medical community? Does it challenge them, or?
People in the medical community are resistant to thinking that their practices might be prejudiced or biased in some way.
We walked into Cedars-Sinai Medical Center with Kira on April 12th of 2016 with a woman that was not just in good health, she was in exceptional health. She went in for the procedure. Shortly after that, we were taken to delivery. God blessed us with another substantially, amazingly healthy, beautiful baby boy.
But unfortunately, the story doesn't end there. Welcome back to A Seat at the Table. We're continuing our discussion on Black maternal health. We're now going to meet Charles Johnson. His wife, Kira, who you just saw, died from hemorrhaging just hours after giving birth to their youngest son. And we also have Linda Goler-Blount, CEO of the Black Women's Health Imperative. Charles, what happened?
We walked into, as I said in the video, Cedars-Sinai Medical Center on April 12th of 2016, expecting our second son, Langston. What was supposed to be the happiest time of our life turned into an absolute nightmare. Shortly after delivery, Langston was born perfect, right, in every way. And so they take us back to recovery. And as I'm sitting there in the chair, Langston is sleeping in the incubator, Kira is resting, and I'm sitting there beaming in all this new dad pride, right, just overwhelmed. And as I'm sitting there, I look at Kira's bedside and I see the catheter coming from her bed begin to turn pink with blood, right? So I'll condense the story for the interest of time, but so I brought it to the attention of the nurses and the medical staff at Cedars-Sinai Medical Center. Keep in mind, very importantly, we went in for the procedure at 2, so this is just before 4 o'clock when this happened, okay? So they come in, they assess her, and they say we're gonna do a couple of things. We're gonna order blood work. We're also gonna order a CT scan that was supposed to be performed stat, okay? And when you say stat, I take that to mean immediately,
Right.
of course, right? So, okay, I'm concerned, but we've got a plan. My wife is in great health, and we're at Cedars-Sinai, right? I can work with this, right? So an hour goes by, no CT scan, okay? The blood work comes back, it comes back extremely abnormal, right? They do a ultrasound, they can see already that she's beginning to bleed internally, her abdomen is beginning to fill with fluid. Another hour goes by, 5 o'clock, 6 o'clock, no CT scan. 8 o'clock, no CT scan. They say, well, we need to give her some fluids. They're pumping with IVs. They do an additional ultrasound. I'm begging, I'm pleading, please do something. At which time the staff at Cedars-Sinai Medical Center tells me, sir, your wife just isn't a priority right now. It wasn't until after midnight that they finally took my wife back for surgery. At this point, I'm relieved because they're doing something. And the doctor says to me, she'll be back in 15 minutes. Now keep in mind, she's been bleeding internally for close to 10 hours, and you never performed the scan, so you don't even know where she's bleeding from.
Right.
They wheeled her into that OR, and that was the last time I saw my wife alive. When they took Kira back into surgery, they opened her up, and there were 3.5 liters of blood in her abdomen. 3.5 liters of blood in her abdomen, and her heart stopped immediately. And so when we talk about this issue, the statistics are horrifying, but there's no statistic that can quantify what it's like to tell a 2-year-old that his mother's never coming home. Right? There's no set of stats that can help somebody understand what it's like to try and explain to a mom that has never met his mother how amazing she is.
Kira is not a statistic.
That's right.
She's a mom and a daughter, a wife. And this is happening far too often. Every day we lose 2 Black moms to what is a lack of basic human decency. And Black maternal mortality is not natural. It's not inevitable. This should not happen. You know, from kind of looking at what's happening, black women die 3 to 4 times more often than white women. In New York City, it's 12 times more often. So why is that okay? But if you talk to physicians and researchers and you ask them why, they'll say, oh, it's obesity, it may be childbirth patterns, it's gestational diabetes, it's hypertension. But then you have to ask, well, why?
Right.
If it's that, why? Well, it's poverty. No, it's not.
Right. Right.
No, it's not.
Well-educated.
Well-educated. It has to do with the lived experience of being a black woman in this society, of being a mom where physicians don't take your pregnancy seriously, who may not even feel you should have children, to be in labor and delivery and have a doctor say, or a nurse, we'll get to you.
Right.
Or what is unimaginable, you're not a priority. Yes, she is a priority. And yes, we are.
Do you see this kind of reaction from both black and white doctors? And why is that?
We do. You might think there would be some difference.
Some more sensitivity.
And there is. I'm not going to say there isn't. But physicians are trained a certain way. Black, white, Latino, Asian, doesn't matter. When you come through the U.S. medical system, you are trained to treat essentially pregnancy and labor and delivery as a condition. Not a wonderful experience and we're just going to help guide new life. Yes, some OBs feel that way. But it's treated as a condition, as a medical condition. And so what happens is labor and delivery become medicalized and doctors treat it, they're not listening.
For me, there was just an indifference, right?
It sounds like that was the case here,
just
indifference.
an absolute indifference. And I felt fear. I can't, it's hard to explain what it feels like to be vulnerable.
Yes.
To have a new baby, you've just pushed an entire human being out of your loins, and to be treated in that way by everyone around you. All of my nurses and doctors were black. I was in a teaching hospital in New York in the middle of the hood. So there were a whole lot of assumptions that were made about me, and they acted in kind. So the only thing that I could think of is if I raise a ruckus here, they're gonna take my baby from me. They had already sent a social worker to the room to check on me and to ask about that man that was by my bed.
That man.
Right, that man, not my husband, that guy.
The assumption that you were doing something.
There was a whole lot of assumptions being made, and all I wanted to do was that I didn't want to even push the button to call anybody, because what other assumption are you to make? And would that lead to you taking my child from me? And so I talked my doctor into letting me go home early, not realizing that put me in danger. Right? Because nobody's watching me. Something like what happened to your wife could have easily happened to me at home.
It's not just maternal care either, because I know of young women who have fibroids and they go to a doctor and they immediately say, I'm going to give you a hysterectomy. When there are ways now to treat those through uterine fibroid embolization that still maintains your ability to have children. Why are we seeing this? It's almost like we don't want black people to have babies.
Well, that is, in fact, what is happening. I mean, it is convenient, and I'm not saying all physicians would make that decision out of convenience. Many, I want to say most, won't. But when you look at the lived experiences of black women and the message we get, which is we shouldn't have children. You remember the billboard that said the most dangerous place on earth is in a black woman's womb? Remember that?
Yes.
That creeps into the practice, and especially when you think about physicians who are trained, who come from other countries, their perspective on black Americans comes from media. They don't have any lived experience with us, so they come into the exam room, they come into labor and delivery with a certain set of assumptions, a mindset that this woman is not as valuable, she's done something she shouldn't have been doing, her child perhaps is at risk, and she really shouldn't have children. So let's do a hysterectomy. Let's take other very invasive procedures to try to deal with her health care, rather than treat her as a woman deserving of the utmost respect and care.
So for all of the people who believe that racism and racial bias is not real and that it doesn't have an impact in our lives and whether or not we live, generally speaking, it's really important to highlight that this is impacting every facet of our society and in the places where we are the most vulnerable. I guess the best question to ask now is, what can we do to change this situation?
Well, just a little bit about racism. There's a whole body of research that people never talk about. There's literature that goes back to 1992 that looks at a causal relationship between experiences of racial discrimination, elevated cortisol levels, and all manner of adverse outcomes, whether it's diabetes or hypertension, heart disease, low birth weight babies, maternal mortality. We see it. So fundamentally, we've got to do more research. But of course, what we accept as evidence comes from those researchers. Very few look like us.
Right.
Now, I noticed, Charles, you are still wearing your wedding band. You have
Absolutely.
your wife's name right here on your ring finger. You have 2 boys who are growing up without their mom.
Yeah.
This has turned you into quite an advocate.
I've had to really come to grips with the fact that there's absolutely nothing that I can do to bring my wife back. No matter how many opportunities I have like this, no matter how many congressional congressmen and women I shake down, I corner, right? I tell them their story and I demand that they take a stance. There's nothing I can do to bring my wife back, but the highest tribute I can pay my wife is to do everything I can, whenever I possibly can, to make sure that I send other mothers home with their babies. And that other fathers and other partners don't have to have the same conversations with their children that I have to have with my boys.
That's right.
Right? I think a lot about the fact that after I've explained it to them, the question that they'll ask is, okay, well, Daddy, what did you do about it? What is it that you did about it?
Right.
And so for me, it's important that when that time comes, that I can say to them that we might have lost, but they didn't win.
Right.
Yes.
And that this is the legacy that we've created in your mother's name. This is the difference that we've made in the impact of families around this country. And this is a legacy that will last and have an impact for generations to come.
Whew. I want to add something about what we can do. If I were to have a baby today, I would go for a doula or a midwife to have someone there to advocate on my behalf, to just put a foot in the behind of anybody and everybody who's involved with my care and the care of my child. There are some incredible women out there, organizations out there that are specifically there to help us usher these lives into the world and to take care of us as we do it. And so I would advocate looking into those and having that advocate there for you. I'm grateful to you for
Thank you very much.
going through what you've gone through and using it to help us spread the word to women, to mothers, to fathers, that they don't have to go through this and that something needs to be done. It infuriates me that we have to have this conversation in 2018, that we could lose your wife and you have 2 little boys that you have to explain that to. That it's not right.
Not at all.
And something needs to be done now.
As the person who tends to think of everything in terms of policy and politics, I just want to make sure that I say that racism is violence. And that racial bias is violence. It is beyond a ideology. It is not just something that we can ignore. It is physically harming families and killing people.
That's right.
And I just thank you for your courage, and I thank you for your work.
Thank you.
Well, the only thing I can say is I am so proud of all you are doing.
Thank you.
And you have to really be an advocate. You have to really question. You have to really get like Serena and blow your top. And each and every one of us, you have a daughter. That daughter one day could be having a baby. She'll have her husband there or that special someone. And unless you keep your foot up somebody's behind and raise questions, this could happen to you. We've got to care. We have got to care. We should not be losing people like Kira.
That's right.
She has so much to contribute,
Yeah.
but lost it because of someone else's inadequacies. Well, thank you both for being here with us. I
Thank you.
mean, you have done a lot. We do have to go, but the conversation doesn't end here.
Please share your thoughts with us on social media.
We're on Facebook, Twitter, Instagram, and Pinterest at ASATT TV.
Thanks for joining us for a seat at the table. And in the words of Shirley Chisholm, if they don't give you a seat at the table,
Bring a folding chair.